Good afternoon and welcome. My name is Tiffany Pieper and I'll be talking about the effects of caffeine on male and female participants' maximum accumulated oxygen deficit. Caffeine is consumed on a regular basis for most people involved in sport. It's an exercising stimulant that is legally accepted in most sports and is accepted by society. Caffeine and its role in exercise has thoroughly been researched, and many views of this research have been developed. Amongst this research is the effects caffeine has on the human body. Caffeine affects the central nervous system and reduces the perception of pain through the blocking adenosine receptors in the human body. The effects of caffeine are dependent upon several characteristics. These include the person's characteristics, the caffeine consumed, and the activity being performed. According to research done by Beck, caffeine effects on anaerobic performance were evident in those who participated in an exercising experiment on a 6-second cycle sprint. The participants ingested 250 milligrams of caffeine and an effect was evident. However, no effect occurred on the Wingate test after consuming 5 milligrams of caffeine 90 minutes before exercising. So it is evident that there are many characteristics that are depended upon to determine if caffeine has an effect on anaerobic exercise. In addition, more research has been conducted on anaerobic performance and found that after ingesting caffeine, the blood lactate levels and anaerobic metabolism rose at high intensities. This had a direct effect on the skeletal muscle and increased the muscle glycogen as well as the strength. Having identified how caffeine affects the human body in anaerobic performance, the focus of this discussion was turned towards MAOD testing. Furthermore, the effect of caffeine was also tested on a progressive cycle, submax cycle, and a supramaximal cycle assessment. It was hypothesized that caffeine has an effect on MAOD for male and female participants. The null hypothesis stated that there's no difference between caffeine and MAOD in performance. However, the alternate hypothesis stated that there is a difference between performance in MAOD and caffeine. An independent t-test was used to compare male and female performances on a cycle ergometer. The dependent variable was MAOD. The independent variable was the caffeine dose itself. 2 male and female students from the CQU University volunteered to participate in this investigation. A stadiometer, skinfold calipers, scales, and tape were used to record the anthropometry measurements. The participants also used a Parvo-Medics True One system and a Watt-Byte cycle ergometer to collect the data. The statistical analysis involved the descriptives, which included the age, height, and weight, which were recorded for both the males and females. A two-sample assuming equal variance t-test was used to compare the volume of oxygen consumed from MAOD results, both with and without caffeine. The p-value was set at 0.05, making the level of confidence 95%. 2 male and female participants enrolled at the CQU University Applied Exercise and Sports Psychology subject volunteered to participate in the study. The anthropometry measurements, stature, girth, breadth, and skin fold, were recorded using the appropriate equipment. Both cycle ergometers were calibrated before exercising as per manufacturer's instructions. VO2 max and submax testing involved 5 minutes rest and 5 minutes warm-up before exercising. VO2 max testing consisted of 5 stages lasting up to 3 minutes, beginning the exercises at 60 watts and increasing by 60 watts per stage. The submaximal testing involved 5 stages as well, this time lasting 6 minutes. Each stage increased 30, 40, 50, 60, and 70% of the VO2 max calculated per stage. A 5-minute recovery phase was needed to be completed after the VO2 max and the submaximal test. The participants also required to keep on any equipment and remain on the bike in this phase. MAOD testing involved 5 minutes resting followed by a 5-minute warm-up, which included 3 minutes at 60 watts and 2 minutes at 90 watts. The exercising phase then began and the subject exercised at their calculated 120% VO2 max until exhaustion. Following the same process, a repeated MAOD test was performed 60 minutes after the participant consumed 3 milligrams of caffeine. In all the testing, the heart rate was recorded at rest and 1 minute before progressing to the next stage. The rate of perceived exhaustion was also recorded 1 minute prior to the next stage. And finally, during the recovery phase, a blood lactate sample was also recorded. As you can see here, Table 1 and 2, these are the demographics information, age, height and weight, which is displayed for both the males and the females. Of the key findings discovered from the experiment, a significant difference occurred between the male and female's MAOD testing with and without caffeine consumed. Represented here is a figure for the male and female MAOD without caffeine. This figure is a representation of the male and female MAOD with caffeine, and you can notice that the diagram has actually increased. So you can see that there is an effect of MAOD that caffeine has had. The present study investigated the effects of caffeine on MAOD, and based off the findings, a significant difference was found between male and female's anaerobic performance in MAOD for no caffeine consumed and caffeine consumed. This significant difference supports the hypothesis that stated that caffeine has an effect on MAOD for male and females, and allowed for the null hypothesis to be rejected, accepting the alternate hypothesis. This study is also supported by the research, which identifies caffeine affecting the body at the neuromuscular level, blocking the adenosine receptors and reducing fatigue. This ergogenetic effect ultimately improves performance, and this is seen in the results of the diagrams. However, within one female's results, the consumption of caffeine actually decreased her performance. According to some research, caffeine can have a negative effect. These include nervousness and anxiety. So this could be an explanation as to why caffeine had an effect on her performance and actually decreased her performance, making the first MAOD better anaerobically. Within this study, the limitations were due to having a small sample to perform the study. For future recommendations, a larger sample should be determined and used. This will help signify if there is a difference between anaerobic performance in MAOD and if caffeine has an effect on MAOD. From the findings discovered in the investigation, there was a significant difference that occurred, and this difference showed support to the hypothesis. Because caffeine has the ability to delay fatigue, it should be an ideal stimulant for those who are choosing to exercise to lose weight or to gain fitness. Consuming caffeine is an excellent drug to take because it actually enhances the training sessions of the individual.